My capstone project was to reduce the patient cycle time, also known as patient waiting time, at the front end of a clinic in Lagos, Oluokun PHC specifically. My name is Dr. Ibiwumi Oluokun. I am a medical officer of health and primary healthcare coordinator at Aig-Imoukhuede Local Council Development Area in Lagos State. I'm a member of the 2023 AIG Public Leaders Programme cohort. My inspiration came from the fact that it's a typical occurrence in primary healthcare centers to see long queues, a lot of people waiting in the outpatient department. And then when I resumed in this local government in January this year, I observed that that was one of the greatest challenges that they were going through here. I also observed that the utilization of the primary healthcare center wasn't so good. So I assumed that maybe this was a low-hanging fruit that we could deal with.
Before the project, we used to have patients waiting for longer periods before they are being attended to. Because that time it's only one doctor that will be on ground to see a lot of patients. But now, by the time she started the project, we'll be having 2 doctors attending to patients. Within a tickle of an eye, we are done.
Like today, we have a lot of patients on ground, like 70. And before 12 o'clock, everybody has gone to advance.
We've tried, but we want to know what we can do.
The first time I will come here this year. Because I'm also a retired staff of Ibiwunmi local government.
Okay, ma. Okay, ma.
This place has not been like this for years.
Oh.
When I got here, I saw it. Everything.
Oh, that is good. Thank you very much. We are very pleased.
The community enjoying it because they are not spending more time like before. So when they get home, they invite others in the community that this hospital, they are up to the task.
We started with the changing of the client flow. That's when we talk about redesigning the facility at large. So we changed the position. There's what we call process map, and whereby the offices of the doctors were moved to more appropriate places. The laboratory was moved closer to the point where their actions.
We moved some staff closer to each other, people that were rendering similar services, we put them closer to each other. We streamlined some of the documentation at medical records. We observed that there was some duplication, so we changed that. We added an additional station for taking patient vital signs because we observed there was some delays at that level as well. And we added a second medical officer to the day duty at the primary healthcare centers. After a very short period of implementation, we were able to surpass our targets for the Capstone project. The impact that I'm most grateful for is that we've been able to scale up improvements from one Capstone project to 64 other PHCs. So we have 64 primary healthcare centers out of the thousands in Nigeria already thinking, how can we do things better? That gradual introduction of a culture of improvement is something that I'm really, really proud of. And I know that if we're able to sustain this and even spread to other districts, we can achieve a lot in improving the quality of the healthcare that we're providing for our patients in Lagos and Nigeria.